Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Van Diesel and I'm 72 years.
Okay, how may I address you?
Please call me Diesel.
Okay, Mr. Diesel. Today I am going to discuss about the health issues of yours. Is that all right?
Okay, doctor.
Okay, and during our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, so now, Mr. Diesel, can you please tell me what have brought you here today?
Doctor, for the last 3 months, I noticed that I have developed some dull pain around my hip and also on my right thigh. And this is,
Right. Hi.
yes, and this is increasing. And I took some over-the-counter medication, but this didn't go away. And I visited my GP. He also gave me some painkillers, but they are not helping me. And after that, he thought that I might have some problem with my bone, so he sent me here.
Okay, I can get it. And uh, can you please tell me that is this present just in right hip or both hip joints?
Right.
Only right.
Yes.
Okay. And you told that you started having this problem around 3 months back. May I know that at that period, at that time, did you had any accident or any trauma?
Nothing, doctor.
Okay. And did this pain come along all on a sudden, or did it develop gradually?
Gradually.
Gradually. Okay. And can you please tell me more about the pain? How is the pain?
It is dull, doctor. Dull pain present all the time and more at night.
Yeah. More at night. Okay. So it's more when you take rest.
Not rest, but I think it is more at night. I feel somewhat good at the daytime when I'm active.
Okay. When you do some jaw work or something like that.
Yes.
Okay. And do you feel that whether there is any morning jamming present or not?
No, I have noticed such thing.
Okay. Well, can you please exactly show me the site where the pain is?
Around the hip joint, around the head of the femur and upper part of thigh, upper part of femur.
Okay. Okay. And is there anything specific that makes it better or worse aside from the night time?
No, I haven't noticed.
Okay. And if I grade that 0 is no pain at all and 10 is the highest pain, how would you like to grade it?
You tell it about 4 or 5.
4 or 5. Okay. And okay, that's all right. And may I know that do you before this around what you told 3 months at the time, did you had any raised temperature?
No,
Okay. Or any skin breach anywhere in the body?
no,
Okay. Okay, that's all right. May I ask you that do you experience any back pain?
yes, doctor. I have that for a long time.
Okay, for how long? Can you please specify?
Maybe for around 3 or 4 years.
3 or 4 years. Okay. And can 3 or 4 years. And have you seeked any medical attention for that?
Yes.
And did they make any diagnosis?
They said that it may be osteoarthritis.
Osteoarthritis. Okay, I can get it. And did they prescribe any medication for it?
Yes. They gave me some painkillers like paracetamol and codeine.
And codeine.
Yes.
Okay. 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 And do you take them regularly, or can
No, when
can
I
you
feel
do you
that
forget?
pain, I take those and I feel better with those medication.
You feel bit okay. And do you feel, in case of your back pain, do you feel that whether there is any morning jamming present or not? Okay. Or any redness or swelling in the back?
No,
Okay. So can you please tell me that how about your water work? Is it all right?
yes,
And your bowel movement?
I am little bit constipated nowadays.
Okay. For how long have you been feeling like this?
maybe for last 3 months.
For last 3 months. Okay. And do you feel any weakness in your legs?
Yes, doctor. On my right leg, I also feel some weakness, and also
Okay.
it
Any?
is somewhat
Okay.
short. It has become somewhat shortened than the left one.
Okay. Right leg has become shorter. Yes, I can get it. Okay. So now, may I know that do you feel any abnormal sensation in your right leg?
No.
Okay. And may I ask you some other questions now? That do you have any headache?
Yes, doctor.
How long have you been having this?
For the last 3 months.
For the last 3 months. Okay. And do you feel that there is any change in the size of your hats or something like that for the last few months?
Yes, doctor.
Okay. Okay. And and do you have any difficulties in your vision?
No.
Okay. Any difficulties in your hearing?
Yes, doctor. I used hearing aid for last 5 years, but for last 3 months, I needed to check it twice. It didn't happen before.
Okay. I'm very sorry to know. Uh, okay. And may I ask you that do you have any joint pain? Any other joint pain?
No.
In rash in any parts of your body?
No.
Any soreness in your mouth?
No.
Okay, just a private question. Any soreness in your private parts?
No.
Okay, and do you have any chest tightness or noisy chest?
No.
Any cough?
No.
Okay, any chest pain?
No.
Okay, do you ever feel any shortness of breath?
Yes, doctor. That has become a recent problem. I feel
Okay,
shortness of breath when I try to walk a little distance, suppose 100 meter,
okay. For how long have you been having this?
for the last 3 months.
Okay, and have you faced any leg swelling? Have you experienced that there is any swelling in your legs recently?
Yes, doctor, I noticed, but that goes away in the morning.
In the morning.
Yes.
Okay. And do you have to use extra pillows at night to be more comfortable?
Yes, doctor.
Okay. Do you feel any racing and pacing of your heart?
No.
Okay. And any okay. And may I ask you some other questions now? That do you have any fever, raised temperature?
I feel that I have some wrist temperature, but generally I haven't measured it.
Okay. Yeah, yeah. Any changes in your weight recently?
No.
Okay. Any weather preference?
No.
Any night sweats?
No.
Okay. And any lumps and bumps anywhere in the body?
No.
Okay. So now, let me ask you that do you have any known long-term disease conditions
I have
other than your
osteoarthritis. I told
preference?
you I don't have
Okay,
any
okay.
condition.
Oh, yeah. Yeah. And may I know that what medication do you take for it again? And can you please
Paracetamol and
tell
cold.
it again? Yeah, yeah. And have you ever taken any overdose of this?
No.
Any over-the-counter medication?
No.
Okay. Any allergy to any medication?
No.
Any medication through your blood channels recently?
No.
Okay. And do you have any family history of such type of diseases or illnesses?
No.
Okay. And may I ask you some private questions, personal questions at this moment?
Okay.
Do you smoke?
Yes, doctor.
How many sticks for how long?
About 10 to 15 sticks per day for last maybe 40 or 45 years.
Okay, actually, smoking can be very harmful, and I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Will that be all right?
Okay.
Okay. Do you drink alcohol?
Occasionally.
Okay. Have you ever had any binge drinking?
No.
Okay, but alcohol is also harmful for health, and it would be better if you stop drinking alcohol. Okay.
Okay.
And may I ask you some other personal questions now? That have you ever taken any party drugs or any recreational medication?
Never.
Okay, that's very good. And have you ever traveled to any country recently or
No.
any different places? Okay. And may I ask you a very personal question? Will it be okay for you?
Okay.
May I ask that whom do you live with?
I'm living alone, doctor.
Okay, okay. And may I ask you that do you drive?
Yes.
Okay. And actually, at this condition, we first have to make a diagnosis. Okay. And before we make it, it would be better for you to stop driving for the time being. Okay.
Okay.
Okay. And may I just know you that regarding your age, are you well supported economically and socially?
Economically, I think that I am well supported, but it has become difficult for me to maintain my own jobs due to this pain.
Yeah, yeah. If you want, we will contact the social services so that they can help you out in this matter. Will that be okay?
Okay, doctor.
And may I ask you just that where the place where you live, do you have to raise upstairs?
Yes, doctor.
Okay. And is there any railing in it?
No.
So actually, I will ask of the doc, yeah, the social services so that they can help you out in this matter. Okay.
Okay, doctor.
Okay. So
It's made.
2 minutes remaining.
Yes.
Okay. So at this moment, may I ask you what your concern is?
Why I am having this, doctor? Is it a osteoarthritis?
Okay, okay. Well, actually, at this moment, I will have to at first examine you thoroughly and make some examine you thoroughly, and then do some tests as well. But as far as I have taken history from you, I think that you are suffering from a condition named Paget's disease. Have you ever heard of it?
No.
Okay, please don't bother about the term. It's a condition in which there are some disorganized bone growth, okay, in your body, and it can sometimes occur in your ages, and sometimes this disorganized bone bone growth and destruction both are present. But this bone growth and disorganized bone growth and destruction can affect different parts of your body, like that happened in your hip, and also it can sometimes affect the affect the joints of the hearing region. Okay, and sometimes it can also cause some difficulties in your breathing as well. However, we have to rule it out by forming a multidisciplinary team involving the bone doctor, the medicine specialist. Okay, and also we will involve the occupational health services and the social services to help you out further in this matter. Will that be all right for you,
Okay,
Mr.
doctor.
Diesel? Okay, do you have any more concerns?
Is it like a cancer, doctor?
Uh, I can understand your concern, but at this moment, what we are thinking as passage disease, it's not a cancer. Okay, it's a condition which for which there are very good treatments available. Okay, but however, we will have to rule it out. We will have to diagnose it at first by doing the tests and examining you. Is it okay?
Okay, doctor.
Any more questions or queries?
Do I need admission?
Well, I think we will. I will talk to our consultant in this matter. Okay, and he will give you a decision in as soon as possible within the very shortest time. Okay, whether you need admission or not. Is it all right?
Okay. Thank you.
Okay. Okay.
Time up.
Okay. Thank you. Okay. So at this moment, I think I would like to do some tests, some examinations with this patient.
Proceed.
Okay. First of all, I would like to tell him to expose properly so that I can have a look at his hip and hip joints and thigh. Is it all right or not?
Going up hip present. Going up femur present.
Sorry.
Going up femur present.
Bowing. Okay, bowing present. Okay, that's all right. And shortening of leg.
Yes.
Okay. Can he walk for me?
Yes.
Well, is there any limping antalgic gait in the right side?
Limping present.
Limping present. Okay. Okay. And then I would like to just test his knee jerk and plantar in both sides.
Flexor.
Okay, and now I would like to listen to his heart,
Okay.
and then I would like to feel his pulse.
High volume pulse.
Okay, and I would like to listen to the back of his chest to look for any pulmonary edema present or not.
Present.
Okay, and look for edema in the lower legs.
No.
No edema. Okay, and okay, and I would like to check his hearing.
Hearing aid present on its
Hearing.
right ear.
Okay, okay. Okay, and I would like to tell him to show his previous tip hat, and if he has any, and try to wear it again, whether it is tight or not.
Right.
Okay, I think that's the examinations I would like to do.
So, can you tell me that what is your diagnosis?
Uh, well, I think that the diagnosis is Paget's disease. Okay.
Do you have any differential diagnosis or any alternative diagnosis?
Uh, Alternative diagnosis, this can be a case of osteoporosis as well. Uh, osteoporotic fracture, and it can be a case of metastatic bone involvement, and I think these are the main diseases.
Can it be a case of osteosarcoma?
Yeah, but highly unlikely. Only 1% chance in Paget's disease.
Not in pages, but will you consider it as a case of osteosarcoma?
Yeah.
Okay. So how do you investigate this case?
Okay. I think investigation. Okay. So I think at first I will have to do some routine blood tests involving including the complete blood count to look for any infection like neutrophilia and anemia like that. Then I would like to do inflammatory markers like ESSCRP. Then I would like to do some X-ray. Okay, plain X-ray both with joints, anterior posterior view, and then I would also like to do bone scan and MRI of bone. Okay, and I would also like to do serum phosphate, calcium, and ALP levels, and vitamin D level as well. And then also I would like to
What do
do
you expect
serum
of
creatine.
serum calcium, vitamin, calcium?
I would like to do.
Phosphate and ALP level?
I would like, yeah, just raised ALP level. All others usually are normal.
Okay, then.
Okay, and then I would also like to do a serum renal function test and serum electrolyte levels as well. Okay, and to rule out any other malignant foci, I would like to do scanning of his chest by doing chest X-ray PA view and also ultrasonography of abdomen.
Do you like to do any
And also,
echocardiogram?
sorry,
Do you like to do any echocardiogram?
yes, echo should be done. ECG and echo should be done.
Okay. So how you manage this case?
Yes, I think I would like to form a multidisciplinary team in the first. First of all, I will have to educate and counsel the patient about the diagnosis. Then I would have to form a multidisciplinary team consisting of a rheumatologist, then also orthopedist or orthopedic surgeon if needed. Then also a medicine specialist, occupational health therapist, and social service workers. And then I would have to go for specific treatment like. There can be physiotherapist as well, and there can be some bisphosphonate therapy. I think that might be very much important in this patient, and also bisphosphonate therapy, and also I think if needed, calcitonin can also be needed, but can also be given in this type of patients. And and I will have to take advice from the multidisciplinary team regarding management of this patient.
Okay. You said the bisphosphonates. Can you name or can you give an example of bisphosphonates?
I think in this type of patients, zoledronic acid and pamidronic acid, these two IV bisphosphonates are much more appropriate.
Okay. How to take the oral bisphosphonates? Is there any specific indication?
Sorry. Can you just stop 1 minute? Murata?
Okay. Can you tell me that any specific advice should be given during taking the any bisphosphonate tablets?
Yes. There are some issues actually. Or both some tests should be done before this bisphosphonate therapy, and also some advices. Among the tests, serum creatinine, ECG, dental hygiene, okay, BMD. This should be done, and during that intake of bisphosphonates, specifically oral bisphosphonates, the patient should be advised to take it in an empty stomach, and after taking it, for at least 30 minutes, the patient should not lie down. He or she should at least be in a sitting position. Okay, that is important.
Okay, fine. Okay, that I was going to take about. That was when you notice that this is the case of pain on the hip and right thigh, you should have asked about other signs of inflammation over the area. Okay.
Yeah, I missed it.
Yes, you missed it. Any redness, any swelling, any warmth. If you asked about the warmth, then patient would say yes, I feel warm over the area.
Yeah.
Any changes in the skin or any changes in the thigh, but in the pain area, then he would say, okay, there is abnormal shape or abnormal going at that area. You haven't asked, so I didn't check.
Yeah.
And then any neurological involvement, any rheumatological involvement at this point. You asked that later.
Yeah. Yeah. Okay.
What are the red flag signs that is present with this patient?
Red flag signs. I think first of all, age. Age is around over 55 years. Then nighttime pain. Then nighttime pain, and then I think I cannot remember.
The patient has history of heart failure.
Oh yeah.
Okay, thank you.
Okay.